let's talk about one of those a-holes who apparently, I mean, this is the beauty. Like if you're just doing a show and you're on the right, you don't, somehow you're able to sort of like ignore the fact that a guy like Asa Hutchinson, who signed what you as a right winger would perceive as like, sort of like signing the Magna Carta, which of course is the mask ban legislation in his state, and now wishing that he hadn't signed it. Here is Ben Shapiro. Now he's decided, I don't know why we should take any precautions for this.
By the way, this is after he came out and said that you should probably get vaccinated, or he came out with some pro-vaccine rhetoric. And so much like Sean Hannity, now that he's facing blowback, he's got to walk it back to CYA. Oh, God.
Case counts don't matter. Hospitalizations and deaths matter. Even if hospitalizations get disconnected from deaths, hospitalizations don't matter as much as deaths do. Okay, so it used to be that case counts were really closely tied to death rate.
Pause it.
Now, thanks to the...
Pause it. First off, the idea that case counts don't matter in the context of a pandemic is absolutely absurd.
Long COVID affects between 10 and 30% of people who catch the virus, including those with mild or asymptomatic infections, according to experts, says the Wall Street Journal.
Correct. And as what does matter is the trend of case counts. If the trend is going up, that means more and more people are going to get it, and that is going to impact your hospitalizations and your deaths and your long COVID cases, and the opportunity for it to mutate into a Delta plus, which may be the thing that we're talking about 2 months from now or 4 months from now in this country. But let's not get ahead of ourselves. The other thing is, I'll tell you why hospitalizations count. Because you can go to Arkansas now, or you can go to Louisiana.
Well, he said they
parts
count
of Florida.
To be fair, but
what's that?
He said hospitalizations and deaths count, not cases.
Oh, he just said we're going to go back because he then qualifies his hospitalizations don't count that much. You tell those to the people in Arkansas and Louisiana and Florida and maybe other places who can't go into the hospital because the hospital's filled up with COVID patients. And you start to get to the point where it's not just a question of beds, it's also a question of personnel. And you're exhausting our medical personnel with this stuff.
Yeah, tell that to the nurses and doctors that hospitalizations don't count.
Yeah, exactly.
Isn't his wife a doctor?
And tell it to his wife. I wonder if she's practicing these days.
Yeah,
maybe
doubtful.
not. Maybe she needs to be called in on an emergency. But go back a little bit and listen to this guy just talk absolute nonsense. What a moron.
Connected deaths. Hospitalizations don't matter as much as deaths do. Okay, so it used to be that case counts were really closely tied to death rate. Now, thanks to the vaccine, that has been wildly disconnected to the point where 90% of all Americans above the age of 65 are now vaccinated against COVID-19, and 70% of all Americans above the age of 18 are vaccinated against COVID-19. And that is not including all of the people who didn't get vaccinated, who already had COVID-19, who probably have natural antibodies or T-cell memory, which means that in all likelihood, you are looking at an adult population in the United States above the age of 18, in excess of at least 75, maybe 80% of all of those people who already have some level of immunity to COVID-19. A very shrinking, diminishing percentage of the population is still highly vulnerable to COVID-19, which is why you have seen this wild disconnect between the case rates and the death rates. We are also seeing an increasing disconnect between hospitalization rates and death rates. Why? Well, because at the very beginning of the pandemic, everybody who went to the hospital was 80 years old and had 3 pre-existing conditions. Now, a lot of the people who are going to the hospital are 25 and have 1 pre-existing condition and are staying in the hospital for, say, 5 or 6 days and then getting out, as opposed to staying for 2 weeks and then dying. And you can see this in the death rates, because who cares about getting diagnosed with COVID if you end up with a mild cold? I'm seeing sheer panic out there today because, wow, Lindsey Graham announced that he had a breakthrough case of COVID and now he's going to self-quarantine for 10 days. So first of all, I am not even sure that it's worth quarantining if you have COVID at this point. Like it's so widespread that I'm not even sure, like on a public health level, whether quarantining is actually going to slow the spread in any significant. Like I get it. I get you're supposed to quarantine if you have COVID. I do. I understand why they're telling you to do this. Because there's so many unvaccinated people out there. But
like this guy has the mind. I mean, this is unbelievable. Why does it help? You are contagious. The Delta variant, I mean, this is unbelievable that someone could articulate this. The Delta variant is even more contagious than the wild type COVID. If you are not quarantined and you are walking around with other people and going into places, you can give it to other people. If you are quarantined and you're not coming into contact with people, you can't give it to them. The concept of why you would quarantine with a highly contagious disease that we don't want to spread, even if you think like he does, that it has no impact on people, that you're in a hospital for 5 days, whatever.
Remember?
No biggie. No biggie. Even if you believe that, to not understand the concept of why you would quarantine with a highly contagious is one of the dumbest things I could ever imagine somebody who fancies himself to be the king of the right-wing philosophers, the intellectual pillar of the right wing, to say. But
remember when Insane Clown Posse had that song where they're like, fucking magnets, how do they work? Like, at least that's actually like kind of a fair question. Like, how do viruses work? Like, we figured that out 400 years ago.
Well, he's trying to say that, the virus is so widespread that why do you even bother, right? Like, that's the whole argument.
Well, then why are case counts going up?
Well, exactly. The point. I mean, so he's trying to say that it's gotten so bad that we should just let it get as bad as it possibly could because, we've hit the bad threshold. And I'm pretty sure that as long as we just let it run rampant, I mean, this is the herd immunity repackaged Delta variant remix that he's coming up with.
I guess that's what it is. I knew somebody who once told me that, like, if you stop cleaning your apartment for 3 years, it really can't get any dirtier.
Sam?
Totally true.
Dirt.
Yeah. I really thought about that anecdote you told us about like it hits a threshold of dust and then you don't have to worry about it anymore. Well, it's kind of like
probably not true.
It's the same situation like how in the medieval ages they just wouldn't bathe because at some point you get so stinky that you hit a threshold and you just keep on. Everyone just holds flowery claws to their noses as they walk by people.
Folks, there's more of what you've just saw where that came from. That's if you hit the subscribe and like button. Thank you. Really, thank you.